So adenomyosis, just going to speak a little bit to that. We've all been here where you think you're dealing with a fibroid and it's not, and you're like, shit, like Paya, like shit, I'm not where I'm supposed to be. And I can tell you pretty reliably that there's no reliable imaging to diagnose adenomyosis, but there are some criteria to suggest that it's there. You could see on an ultrasound, this was interpreted as a fibroid, but you could see now retrospectively, hindsight's 2020, that's probably adenomyosis. And what do you do with that? Well, if you're pretty sure about that it's adenomyosis, I tend to leave those alone. Even though there is literature suggesting that adenomyosis is related to a decreased chance of getting pregnant, I tend to leave them alone and counsel them. Obviously blood flow, if the blood flow is not distinctive, you can see it's just all over the place there. So I use Doppler flow to amplify the diagnosis. And then obviously MRI. So you can see there's something going on there, right? And there's deviation, but you can see there's no strong borders, there's no distinction. This is all myometrium with infiltrative endometrial glands and stroma. And we've all been here, no obvious cavity. You can see here, that patient that I just showed you, I just kept continuing. I resected as much as I could, but I don't know how much to resect, so I just did the best I can, entered the cavity. There's still residual, you can see this is very obvious glandular tissue, and I just did the laparoscopic closure and resected as much as I can. And I don't think I have time to show this video, but it's tough. These things bleed a lot. They just bleed, and you don't know what you're putting together, and the suture pulls through when you're trying to put it back together. But it's a challenge. It's definitely a challenge. But my fellow wanted to keep going and wanted the practice her intracorporeal tying and stuff. I didn't have the robot or anything like that. So you can see it's very soft. I'm trying to demonstrate softness there. But you just try to do the best you can in putting that back together. Okay, so adenomyosis does affect fertility, so you have to have that conversation. Okay, and it's there's a meta-analysis. It is affiliated with decreasing implantation rates, and you just have to counsel them like you do with endometriosis. These women have implantation issues, and you can't just like endometriosis, you can't remove all the endometriosis, and you just have to counsel them that it's going to have a lower chance of getting pregnant. And it's controversial. You know, there is some studies, and I'm showing this one that showed no difference. So it's just more of a matter of discussion regarding counseling regarding the outcomes of adenomyosis. I do get a lot of questions about the utilization of Lupron. I would say how I practice is I usually just go ahead and do the IVF cycle anyways, whether they're doing genetics or not, and do an implantation of 1 or 2 embryos, and you know, without Lupron. And then if they're still having implantation issues, then I do a trial of double Lupron. But the literature is very, very soft on whether or not that actually makes a difference.